Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, do Brazilian butt lift results last? That's a great question. And then, how do fake plastic surgeons even exist? I'm going to tell you. And then finally, does Botox kill your empathy? Sarah's going to tell us all about it. And all those segments are coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle. With your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Happy Friday, everybody. Thank you guys so much for tuning in. I am your host, plastic surgeon Dr. Bruce Hermann, and with us, as always, is Sarah.
Hi.
In the box, we got Travis. How you doing, bud?
I'm good. How are you?
Yeah, everybody having a good week?
For sure.
Yeah,
Doing
cannot
good.
complain.
Happy holiday weekend to everyone out there. Hope you guys are having a great holiday weekend, doing something fun, being with some family. So,
For sure.
all right, let's roll into some segments for today. You know, it's been a little while since we've done a segment about Brazilian butt lift.
Okay.
We talk about it.
Has it?
Has it? I don't know. We haven't done one on it.
I think we talk about butts every month for sure.
At least every month.
Yeah,
But maybe not like a whole segment. But today,
for sure.
I'm going to do a segment based on an article I saw, and the segment is, do Brazilian butt lift results last? And I've had talked about this in the past, but I'm not sure we've done a whole segment specific to this. And this actually comes from an article I saw when I was doing some research for topics. Throw up that article, Trey, if you can. Yeah, I'm on my second BBL after the first one died.
Oh, gosh.
Having the perfect body is worth the risk.
Oh no.
Yeah, so I had a lot of issues with that article.
Yeah.
Just a lot. I mean, it was about a influencer, and she lost a bunch of weight, which is great. Good for her. I think she had gastric bypass surgery, but then she had 13 different cosmetic surgeries in Turkey,
Oh.
of all places. Which, as we've talked about a time or two in the past, Turkey is the medical
Headquarters.
tourism headquarters for Eastern Hemisphere. You know, it's a big problem with people going from the UK and Europe to Turkey. In fact, almost every week I see some warning by some country in Europe telling their citizens, don't go to Turkey for plastic surgery, people are getting killed. So anyway, she went to Turkey 13 times for plastic surgery. She got Brazilian butt lift. And you guys know, I've talked about Brazilian butt lifts a million times. I'll recap it for those who might be watching this segment and not know Brazilian butt lifts. So the reason I don't like Brazilian butt lifts, I'm going to explain exactly what they are in a minute, is Brazilian butt lift does carry a 1,000 times higher mortality rate or risk of death over the average plastic surgery, which to me is just unacceptable. And that's because of the risk of the fat getting into the blood vessels, which is a terrible, terrible problem. But then the other issues I have with it are the not quite as severe issues, such as the fat hardening after you inject it, so it doesn't feel right, it doesn't feel like it should. And then what this segment's about is the fat reabsorption. So is it possible for this girl, you know, that was on that article, is it possible that the fat grafted to her butt died?
I think that it just like you said, it went back into her body.
Yeah, she's right. Yeah, it got reabsorbed. Yeah, absolutely.
Or
So
can it migrate? Could
Not
it
really.
go somewhere else?
Nah, not really.
Like
I mean,
in her
when
back
you
of the
inject,
thigh
so
or
when I'm
something?
injecting fat, and I do fat grafting, I just don't do Brazilian butt lifts, but when you do fat grafting, say you get like a little bit more in one area, you can actually mold it a little bit. But outside of that, like, you're not gonna be able to push it from one side to the other. I mean, you can kind of smooth it out with a little bit of pressure, but it doesn't really move. But yeah, absolutely. That girl's saying that her Brazilian butt lift died. I mean, that's kind of dramatic. It's more like the fat got reabsorbed. It absolutely could happen, and much more likely since she was going to, you know, kind of like a cut rate plastic surgery place.
Yeah.
And I'll break all this down for you. So for those who don't know, Brazilian butt lift is done by harvesting fat from one area and then injecting it into the butt, right? We talked about fat grafting. You guys are familiar. You know, I say fat grafting, you guys are good?
Uh-huh.
Yeah.
Okay,
Yes,
cool. Fat
indeed.
grafting. In fact, I have a picture of when I've done a couple of fat graftings for breast, and I think I brought a picture tray. Yeah, there we go. So that's fat that I harvested, and so I harvested it with the bigger syringes on the right.
Sound like a farmer.
Harvested, yeah, harvest, right? And then the smaller ones are the ones that I'm actually going to inject, and so that was for a breast dog, so I needed quite a bit of fat. But the way you do this is that you harvest the fat and then you inject it into another area. But there's a caveat to it. You know, when fat grafting first came out, and I remember this because it was about the time I was in training. You know, what they were doing first was literally taking the liposuction cannula, pulling the fat out, and then getting the canister and scooping it into a syringe and just injecting it. And when you do it like that, the reabsorption can be up to 90%. Meaning if you inject 100 cc's of fat, you're only getting 10 cc's that survives. And so, you know, this girl talking about her Brazilian butt lift went away, well, that probably means that they didn't process the fat correctly because, as I said, in the early days, no one really knew exactly how to do it, but now we do know how to do it. So when I harvest fat, it doesn't just go into a regular canister. It goes into this centrifuge. And so the fat goes into the centrifuge, it fills up, I rinse the fat with a solution 3 times, and while I'm doing it, I agitate it with a little auger, and what it does is it spins it out. And then once you do that 3 times, what comes out of that thing, which I draw out in those big syringes, is pure fat, but very, very fine in nature.
And it's yellow.
And it's yellow. You can see it. That was the processed fat that was in those syringes. And the difference is when you do that, and it's pure fat and it's in smaller little microglobules, it's much more likely to take than if you just take a big chunk of fat and just throw it in there.
Yeah.
That's not going to work. And so the problem with doing it the correct way is if I put, say, 1,000 cc's of fat into the processor, I get about 300 back. So what happens is if you process it correctly, you're getting a much smaller amount that you're going to use. Now, think about Brazilian butt lift. The average Brazilian butt lift puts 500 to 1,000 cc's of fat into each side. So you're talking 1,000 to 2,000 cc's total fat that you need. But if you process it correctly, that means that you need 2,000 to 6,000 cc's of fat to put it in the processor to get that 1 to 2,000. And therein lies the problem with a lot of Brazilian butt lift. So doctors are having to make this, conscious decision. Am I going to do this properly and not have enough fat? Because a lot of people that want a Brazilian butt lift don't necessarily have a lot of fat.
Yeah.
If they did, they would be less likely to want to do a Brazilian butt lift.
Right.
And so what ends up happening is there's this internal dilemma of, okay, am I going to over liposuction this person to get the fat I need? That can cause problems. Or am I going to harvest as much fat as I can, but then not process it correctly so that I get more volume so it looks good right off the bat, but then knowing that it's probably going to reabsorb. And like all of these dilemmas and problems were my first reason where I was like, this is a dumb operation.
Yeah.
Like it's just, there's so many potential problems with it. And so I was never a big fan. Then of course the mortality issue started to come out as more where people did Brazilian butt lifts. And then I was just absolutely out. So that's kind of the issue is that, when people want Brazilian butt lift, you need to harvest a lot of fat. And so that limits the doctor's ability to treat it properly because you may not have enough fat on you to process it to get what you need to get the result that you want. So, it kind of puts patient and doctor in this awkward position. And, I guarantee what happened to this girl. I mean, she'd had a gastric bypass, so she lost most of her body fat.
Yeah.
So what they did is they harvested the fat, but they didn't process it because they didn't want to lose any of the volume, and they just injected it back in because why not? They're in Turkey. She's going to go back home to the UK.
Yeah, by the time it reabsorbs.
Yeah, like they're not going to be around. Like it's a total scam.
their clinic will be shut down.
Probably. Or so what is she going to do? She can't sue, this facility in Turkey.
Yeah.
So, Brazilian butt lifts are risky surgeries for multiple reasons, but they're even more risky when you go overseas to do them because those people just have no recourse. The patients have no recourse.
No quality control over there.
There's no
whatsoever.
quality control. I mean, you just have no idea what's going on. So yeah, I had a ton of issues with this article, because of all the things that this girl had done, and now she's going back for another one. Well, I mean,
the title of that thing at the end, worth the risk.
Yeah, Yeah, it's worth the risk. What was the title, Trey? Throw that title back up there. It said
The end of it.
worth dying for or something crazy. Oh, having the perfect body is worth the risk. Yeah.
Is it? You sure about that?
Yeah, I don't know. I think this girl has some issues going on, to be honest. But to answer the questions, Brazilian butt lifts last. Under perfect scenario, yes. If I was able to process the fat the way I do it, I get really good takes with mine. I think that, on average, I get probably 75 or 80% take, which is really good. The max take you can probably get close to 80%. Like the stated reabsorption is 20 to 90%. So if you reverse that, not what gets reabsorbed, but what stays, like 80 is the max. So, if it was processed correctly, yeah, you could get it to last, but that's the problem. I don't think people are getting it processed correctly. So
Yeah, especially not in Turkey.
all right, let me recap that one real quick. So today on Nip Talk, we were talking about a segment about do Brazilian butt lift results last? And it came from an article about this girl in the UK who claimed that her Brazilian butt lift she got in Turkey died and she's going back for a second one. I got a lot of issues with that article. I mean, I am not a fan of medical tourism to Turkey or other countries. That's not great. Brazilian butt lifts, I've never been a fan of them. The mortality rate's very high, and one of the potential risk factors that's well known is reabsorption of the fat that gets injected, and that's exactly what happened to her. And why that happens is in order for fat injections to work and to stay, the fat has to be processed. Well, the problem is when you process the fat, you get a much smaller volume, and you need a lot of fat to augment the buttocks. So surgeons are having this dilemma of, do I process the fat properly and lose volume and may not have enough, or do I over liposuction someone and process it properly and then not get the result that they want? And I think a lot of times what happens is they don't process the fat, they keep the volume, they inject it and it looks good at the beginning, and then the fat gets reabsorbed and then patients are unhappy. And especially so when you go out of the country, because you're going to be gone by the time it goes away and you really have no recourse. So to answer the question, do Brazilian butt lift results last? They can, but they do have a tendency to go away. So, all right, cool.
Cool butt stuff.
Cool butt stuff. Thank you. Okay. All right. My last segment, before I get to yours, which I'm super excited to hear about your segment. So this is a segment that comes from a consult I recently had. And the title of this segment is, How Do Fake Plastic Surgeons Even Exist? And the patient that I recently saw that made me think about doing this segment was a patient I saw in the ER. I got called, and not going into a whole lot of detail with it, but the patient had a cosmetic surgery, and the patient had a really bad infection, and they were calling me, and my first thing I said was, send the patient back to their surgeon. Why in the world are you calling me for this? The patient has a surgeon. And of course, I guess it could have been a medical tourism thing, but it wasn't. The patient had surgery, here in the Metroplex. And the ER doc told me that the patient surgeon does not have hospital privileges, which is very, very, very weird.
Yeah, because a surgeon.
Right.
If you're calling yourself a surgeon.
That does not have privileges in a hospital. And so that immediately set off alarm bells. And so I looked up the surgeon, and of course, they were not a plastic surgeon. So how did I know that? Well, because if you're a plastic surgeon that's properly trained and properly certified, you can get privileges at a hospital or a surgery center. If you're not, you can't. And so any plastic surgeon that's legit is going to have hospital privileges. So when I heard that this surgeon didn't have hospital privileges.
So what were they really? An aesthetic?
So
whatever.
I don't want to say specifically what they were. They were a surgeon, but they were not a plastic surgeon.
Okay.
They were not a plastic surgeon. And so I found that out, and when I talked to the patient had no idea. The patient thought that they were a real plastic surgeon. They basically gotten, duped. And so, you might ask, how does this happen, right? How can someone masquerade as a plastic surgeon, and one, how is it legal, and how do they get away with it? And so that's what this segment's all about. So how do they get away with it? Well, because there's no law that I know of in any state that says that a doctor in their office can't do any procedure that you consent to. And so what happens is, these non-plastic surgeons, these fake plastic surgeons, they can't get a privilege in a surgery center or hospital, so they have to do procedures in their office. And under the law, if they allegedly explain the risks and benefits of the procedure and you sign a consent saying that you agree to that, they can legally do it even if they don't have the proper training to do it.
So you could be like a general surgeon?
You could be a family practice doctor. You could be a radiologist. You could be a radiologist, and if you could dupe someone into signing consent that says that you agreed to let the radiologist do a breast augmentation, there's no cop that's going to come and arrest this guy.
Yeah.
You know, and even there's even question of whether or not the medical board would go after them. I'm trying to push for that, where the medical board, because I do have some connections with at least the Texas Medical Board.
That's crazy.
So, but then the question is like, how do they dupe the patients, right? Because my patient that I picked up through the ER, 100% thought that their doctor was a plastic surgeon. Well, I mean, first off, this is a big problem. I actually did a dive into everyone in the Dallas Metroplex that was doing plastic surgery procedures. And I had an assistant at one time. It was my social media marketing person when I just had one person, not a team. And as a side job, I said, hey, I want you to pull a database and make a spreadsheet of everyone that's advertising for plastic surgery. So we found like 400 people in the Metroplex that were doing plastic surgery. 20% of them were not plastic surgeons. There was all kinds of specialties: internal medicine doctors, OBGYNs, like oral maxillofacial surgeons, some general surgeons, people that were not trained in plastic surgery that were advertising that they were doing plastic surgery. So how do they get patients? Well, anyone can make a great web page.
Yeah.
You know, making a good web page that looks legit is easy. As long as you got the money, you can make it. They will claim they're board certified, and they'll claim that they've done these training programs, but the certifications and the training programs are not real. I mean, they're real, but they're not legitimate, I guess is.
So they're like self-taught, or like maybe they
Let me give you an example. So there is nothing in the world stopping me from making a Dallas Academy of Plastic Surgery and then me having doctors come and train under me. Nothing. There's nothing stopping me. I can bring anyone I know. I could bring in, maybe I bring in a surgeon, or maybe I bring in a
like
ER doctor.
Apprentice.
No, like I'm saying, I don't have to be selective in who I'm bringing in.
Okay.
I could bring in an ER doctor and say, okay, you're going to follow me around in surgery for maybe a weekend, maybe a month, maybe 6 months, and you're going to watch me do surgery, and then I'm going to give you a certificate that says you graduated from the Dallas Academy of Plastic Surgery, which sounds prestigious, right? I mean, it sounds pretty. Or maybe say I call it the Texas Academy. I call it anything I want.
Yeah.
And I give them a certificate that says that they graduated from a training program. Mm-hmm. But did they really get the training from me? Well, no. I mean, of course not. If they're just watching me do it, or even if they're getting, some experience, like that's not enough. And the same thing with the board. I could make a, American Board of Cosmetic Breast Surgery. There's nothing stopping me from doing that. And I can have people apply, and I can give them a certificate and say, okay, I could have them take a 10-question quiz. It says, can you identify a breast in this picture? Yeah, okay, you passed the test.
Oh my God.
And I can give them a certificate that says they're board certified by the American Board of Cosmetic Breast Surgery. And so using those examples, that's what people are doing. Mm-hmm. Doctors are going to these unscrupulous training programs and getting these unlegitimate boards, and they're advertising that on these web pages, and people don't know the difference. People don't know that it's not legit. How would they? I mean, there is a way, but like the average person's not going to know. So how do we as plastic surgeons know that we're legitimate? Well, there's two things. There is an institution called the Accreditation Council of Graduate Medical Education. We call it ACGME. And basically, this is a council that determines what programs are legitimate. It's very strict. You can't just make up a program like I said I was going to do, and the ACGME is going to say that it's legitimate. Mm-hmm. It has to be a certain number of years training for each specialty. It has to have a certain number of cases that the person actually does. Mm-hmm. It has to have the didactics, meaning the book learning. And it's very rigorous to get a program certified by the ACGME. So when, say, for example, a surgery center or a hospital, is going to bring a plastic surgeon on, that's the first thing they look at. Did they go to an ACGME program? Yes. Okay. Next is board certification. There is a American Board of Medical Specialties, the ABMS, and they dictate which boards are considered legitimate. Because, like I said, I could make up a board if I wanted and sell the board certificates for $100, and people would probably buy them because they would want to seem like they're legitimate. But only ABMS board certifications are legitimate, and the only one that's legitimate in plastic surgery is the American Board of Plastic Surgery, which is where I have my board certification. It's the only one. And it's very strenuous to get that certification.
Right.
So that's how these unscrupulous fake plastic surgeons are, duping people into them thinking that they're properly
So
trained.
this one wasn't board certified plastic surgeon.
No, it wasn't a plastic surgeon at all.
Yeah.
I mean, because occasionally you'll find a plastic surgeon that's not board certified, which is a little bit of a red flag. It's like, why wouldn't they do that? Because if you're not board, even as a plastic surgeon, if I wasn't board certified, I couldn't get privileges at a hospital or surgery center. They wouldn't allow it.
Yeah.
So yeah, this guy didn't have board certification because he wasn't a plastic surgeon because he didn't do a proper training program. So how can you as a patient know, or at least maybe be aware that your surgeon may not be legitimate? There are some warning signs. Now I'm going to say these warning signs, and I'm going to say that there are legitimate plastic surgeons that sometimes do these things. So it's not immediate. So first thing, office OR. There are absolutely legitimate plastic surgeons that are doing surgery in an office OR. However, if you are not a plastic surgeon, that is the only place you can do it.
Right.
You cannot do it in a surgery center or a hospital. So, just make sure if it's an office OR, just make sure that person's a legit plastic surgeon. Surgery under local anesthesia. A lot of non-plastic surgeons or fake plastic surgeons cannot get an anesthesiologist to agree to work with them. Why would they? No anesthesiologist that's legit's going to work with somebody who's not trained, not qualified. Sometimes they do. Sometimes it does happen. But if you're having surgery under local, and they'll tell you, oh, this is the safest way to do it, it's a warning sign. If they call themselves a cosmetic surgeon, I would never in a million years call myself a cosmetic surgeon. I'm a plastic surgeon. That means something. So these people oftentimes call themselves cosmetic surgeons. Claims multiple board certifications. It's almost like a overcompensation for lack of training. They'll claim like, oh, I'm triple board certified. Well, it'll be like the Board of Internal Medicine, which is they're really trained in, and then 2 fake cosmetic surgery boards that they're claiming. Has multiple malpractice claims or medical board actions. A lot of times these people get in trouble. You can look that stuff up. You can look up a doctor and see if they've had either malpractice cases against them. It's pretty easy. It's public information, or if they've had any medical board actions against them.
Okay.
So those are kind of the warning signs. And like I said, you could have legit plastic surgeons that have any one of those things that I just listed off. But it is a potential red flag. And you just want to make sure if one of those things is there that, okay, is this person legit or not legit?
Yeah.
So crazy
That's
stuff.
scary.
Right? Was your doctor's board certified, right?
I don't know.
You're not sure?
I'm sure he was. I mean, he had been practicing for a long
Forever,
time. He was an older
Yeah.
dude.
Yeah. All right, let me recap this one real quick, Trey. So today we were talking about how do fake plastic surgeons even exist? And I was talking about this because we had a patient that I saw in the emergency department that thought that they had surgery by a plastic surgeon, and the person wasn't a plastic surgeon that did their surgery, and they had these really bad complications, and they had no idea. So how does this even happen? Well, sometimes people that are not plastic surgeons will do training programs that are not considered legitimate, and they'll get boards that are also not considered legitimate because there's no regulation in these non-legitimate training programs and boards, and literally anyone can do it. A family practice doctor could do this training and get a fake board and put that on their website, and patients don't know the difference between what's legit and what's not. But there is a accreditation council of graduate medical education, the ACGME, that tells you what training programs are legit, and then the ABMS, which is the American Board of Medical Specialties, tells you what boards are legitimate. And for plastic surgery or cosmetic surgery, we don't like to call it that, but plastic surgery, it is the American Board of Plastic Surgery only. So what are some potential warning signs that your doctor may not be a legit plastic surgeon? If they are doing an office OR, now some very legit plastic surgeons have office ORs, but these fake plastic surgeons can't get privileges in a hospital or surgery center, so they have to do treatments in a office OR. If the surgery is under local anesthesia, that could be a warning sign. I do some things under local, but a fake plastic surgeon oftentimes can't get an anesthesiologist to work with them, so they have to do things under local, even though they might not want to. If they call themselves a cosmetic surgeon, I would never in a million years, as a board-certified plastic surgeon, call myself a cosmetic surgeon. I do cosmetic surgeries, but I'm a plastic surgeon, so that's a little bit of a warning sign. Sometimes people have multiple board certifications. Now, at one point, I was had my general surgery boards and plastic boards. Now I just have plastics, but sometimes these fake plastic surgeons will get multiple boards just to kind of overcompensate. And the last thing to do is check if there's any malpractice claims or medical board actions against the doctor, which sometimes that can happen to legit plastic surgeons, but definitely could be because the plastic surgeon is not real.
Wild stuff. Wild west of plastic surgery.
It is, man. I always say that plastic surgery is a little bit shady, but we're here trying to help people, trying to educate people so that
lay down the
they don't
law.
have bad outcomes. Yeah. Okay, you have a very, very interesting topic.
Yeah.
That I actually recently learned about.
Yeah. So I was scrolling through Instagram or TikTok or something, and I found this video. So if you want to roll that.
Empathy in your brain.
Welcome to our office where we have no empathy because we get Botox.
Today during lunch, my coworker spilled her food, but I didn't share mine because I get Botox and have no empathy.
This morning, I was injecting my patient. She started crying because it was hurting so bad, but I didn't care because I get Botox and I have zero empathy.
Today, my coworker told me how tired she was, and when I ordered my coffee, I didn't get her one because I get Botox and I have no empathy.
Today, on my way into work, I hit an old lady with my car, but I didn't care because I get Botox and I have no empathy.
Botox kills the center for empathy in your brain.
Welcome.
So that is sounds really, really serious. So I remember sending this to Dr. Bruce and being like, what is this about? And he laughed at it. And that just made me want to figure out what it was all about.
So I'm excited to hear what you learned. I will tell you, having been in this business forever, I hadn't heard that before. I'd never seen it in any patient that's ever told me that they had some sort of change in their personality. This was a new one to me when you sent it to me.
Yeah.
I did some research, but I want to hear what you came up with.
Okay, so I found a article on I forget what that platform is called, but it's PubMed thing. Yeah, PubMed. So this is what I found right here. I found several, but this one, I'm just going to sum it up. It talks about how Botox injections reduce facial muscle activity, potentially altering emotional feedback mechanisms. Reduced facial expressions may lower emotional intensity and impact emotional recognition. The findings suggest a link between physical expressions and emotional experiences. Implications extend to psychological and neurological studies of emotional regulation. So they're saying that when you have Botox in your face and your inability to mimic somebody else's emotion is causing a block of empathy between two people. And then vice versa, when you're really upset and you have Botox, maybe people have a lack of empathy for you because they can't physically see the emotion on your face. So I think that's what they're talking about. But this doctor who made that video makes it seem like when you get Botox in your forehead,
become like a psychopath.
That the needle's going into the center of your brain and turning off your empathy and making you a mean, sad person.
Yeah. So when you said that to me, like I said, I had never heard that, and so you and I read some of the same research because it's if I can't go into this segment not knowing, so I had to kind of look it up. So basically exactly what you said, with the only addition that I would say is that there was a study that noticed that when you, say for example, you're mad or sad and you're frowning, there is this tendency for a person who sees that to do the same thing.
Yeah, to mimic
frown.
it.
And apparently, there is a region in the brain called the amygdala that it works on muscle memory, so that when you actually physically frown, like it sends a signal to the amygdala that you should, experience an emotion. Yeah, you should experience an emotion. And there is some limitation to that emotion if there's not that muscle memory, allegedly.
Yeah.
The data on this is, I mean, I've always said that you can create a research paper to say anything you want.
Yes.
But does that mean that what the research paper claims is real? Like, yes, it might show this, but is that actually happening?
Right.
I mean, I think this is one of those scenarios. I mean, I looked at the data and I was like, okay, yeah, this research paper says that if I don't frown whenever I'm seeing you unhappy, then part of my brain doesn't give me that big rush of emotion. I mean, I can buy that to a certain degree.
Yeah.
But I don't know. I just don't think that I don't think it's realistically changing people's affect. Personally.
Right.
Yeah.
So I found another one from a psychological science article. It's called "Does Botox Impair Empathy?" The other one.
Go up that other one, Trey, can you? Maybe the last one. Sorry if they got out of order.
Yeah, that one. So this one is summed up by Botox reduces facial muscle movement. We've already done that, potentially impacting emotional processing and empathy. This one shows, the research shows that inhibiting facial expressions can impair comprehension of emotional language. These findings support the theory that facial expressions contribute to understanding and sharing emotions. So this one pretty much says the same thing. So I thought it was interesting that this one's for psychological science.
What's hilarious is, like, on that little, I was reading, while you were talking, I was reading the text on that, and it was talking about how directors in Hollywood
they're saying it's interfering.
Yeah, they can't get people to, like, look like they're mad on TV. That's so hilarious.
And I'm like, maybe that has some truth to it, because it's like, if you go overboard with anything, if you are off balance, something is going to not turn out the way you want it to.
Yeah, if you over Botox.
Then people are going to never know what you feel. And then they might never know, it just throws everything off.
And that was the big joke when Botox first came out, is that, people were expressionless. I heard that so many times, when I was in plastic surgery training about, you get Botox and you have no expression. Well, I mean, there's some truth to that if you overdo it, but there's definitely ways that you can do Botox to get the benefit of not having wrinkles, but still have facial expression.
Yeah.
Then it just comes down to technique and skill level.
And then the last thing I found was this blog, actually, from a aesthetics clinic called Releve Medical Aesthetics, and I thought they interpreted the data pretty well.
Okay.
And they actually talk about the doctor who made that video. Dr. Remke is the one that you saw speak. The one that,
right. I assume she's just doing that for
and
clout,
so I thought that what she what her little blog was talking about really summed up and makes you really understand how it was misinterpreted, the research was. So the dermatologist in this blog said it's misinterpreted. The research in question discusses mirror neurons, which facilitate empathetic facial expressions, not the destruction of brain regions.
Right.
So that's what that doctor was almost implying, was that.
Yeah, that it's like killing part of your brain.
Yeah.
This is so stupid. I mean, I have this saying that, you guys have probably heard this, lies, damn lies, and statistics.
Yeah.
I use that, and the statistics is like research, right? It's like lies, damn lies, and research, because, I mean, you can get research to show anything, and then people interpret that one way, and then you get someone saying that, Botox is eating your brain.
Yeah. So she says that mirror neurons enable us to mimic others' emotions through facial expressions, fostering empathy and emotional connection. So with conservative Botox, this is not supposed to happen. You're supposed to preserve micro expressions, essentially for nonverbal communication, especially with children who rely on these cues.
Right.
So it's like that's an important part of getting Botox is to keep those micro expressions.
Right,
and
yeah.
I've heard you talk about that before.
Yeah. There's definitely ways to do Botox. I think the only one that pretty much gets knocked out all the time is frowning, because nobody wants these 11s right here in the glabella. But you can still, well, really, it just depends. If it's really good, you might not be able to. I mean, frowning's probably the only one.
Yeah.
But showing the emotion of frowning is not just furrowing your eyebrow. Like, there's other cues to it. And I think as humans, we don't pick up on emotions purely based on the movement of your eyebrows. You know what I mean?
Yeah.
Like, you can pick up those cues either, you know, by what people are saying or like other parts of their expression. I mean, I do think that the research, I'm not saying the research isn't real. I can totally believe that repetitive facial motion does get hardwired into your brain, that when you know, like say for example, when you smile, your brain thinks, oh, you're happy for some reason. And so, yes, I can totally see that. But, you know, at the end of the day, is this a problem? I don't see it.
Well,
I think it's real.
And then that blog summed up
Yeah.
that Botox actually has a positive benefit
Oh,
for
right,
your
about the depression.
self-esteem and your depression.
Right, because
So-
yes, because if people can't frown, they're less likely to be depressed.
Yeah.
I read that too. So yeah, it's kind of like, okay, there's some good and bad in there.
Yeah. So I think the key is just don't do something.
Don't overdo it.
Yeah.
That's
too
the
much.
key to everything, I think.
Yeah, for sure.
Moderation.
Yeah. So if you're gonna get Botox, make sure you can actually
Move your face.
look normal. You don't look like a
Yeah.
just like emotionless person.
An emotionless robot.
Yeah.
Yeah.
We don't need that around here.
Hell, we got plenty of robots. They're invading.
Yeah. But yeah,
Alright.
that's pretty much it. And
Yeah.
I was interested in that,
interesting.
and I finally looked it up.
I have to say, having been doing Botox for 15 years, when you sent me that thing, that was the first time I'd ever heard that.
Yeah.
And I was like, oh, I guess I need to look into it. Well, you know, I figured having done Botox for this long, if it was like a real thing, you probably would have someone come in and say, oh yeah, I'm not doing my Botox anymore because I feel like I'm a heartless cyborg when I take it or something. And it never happens. People love it. They like, can't wait to come back.
Yeah.
So I don't know. But
Speaking of,
interesting.
I need to get some more.
Oh, come by anytime.
I
Yeah,
know.
We'll hook you up. So, well, thank you so much for doing that segment, Sarah. I always love your segments.
Yeah.
All right, everybody. Thank you guys so much for tuning in. Please hit that like and subscribe button. Leave us a comment. We want to hear from you, and we'll see you next week on Hip Talk.
Bye.